Hello, I'm Dr. James Ludwick, and I'm going to talk to you about one of the most common causes of nasal congestion, big inferior turbinates. So what are inferior turbinates? Inferior turbinates are what make our nose special. The reason we want to breathe through our nose is because it warms the air, humidifies the air, and cleans the air. The inferior turbinate is an organ that comes off the side wall of the nose and adds all this surface area to the nasal cavity. Okay? If we turn the head sideways, you'll see that the inferior turbinate goes from the front of the nose to the back of the nose, the entire length of the nasal cavity. We have a lower one and we have a middle one, but the turbinate most involved in nasal congestion is the inferior turbinate. When we breathe through our nose, air passes over the turbinate so water can efficiently evaporate into the air and condition the air for us. When we have big inferior turbinates, it blocks the airflow through our nose. Turbinates can swell for lots of reasons. Sometimes they're just big, and sometimes it's due to things like nasal allergies. When the turbinate swells, it takes up a lot of room in the nasal cavity, and you just can't get the air through your nose. Afrin and Sudafed are nasal decongestants that constrict the blood vessels of the turbinate and literally squeeze the blood out of the turbinate. And it takes a grape and essentially turns it into a raisin temporarily. So while the turbinate's nice and small, you can breathe great until the medication wears off, and then they swell again. Fortunately, we have great and easy ways to treat inferior nasal turbinates called turbinate reduction. So just like you can make the turbinate smaller by using chemicals such as Afrin or oral decongestants, we can also make that turbinate smaller with simple office procedures. The great thing about the office procedure is that it's permanent, thus allowing you to breathe easier through your nose all the time without having to rely on those topical or oral decongestants.